Welcome back to I'm Still Here. I'm Larry.
And I'm Heather. In 1998, at the age of 26, I was diagnosed with stage 4 breast cancer, but I'm still here.
Good.
Whew. And I have a lot of experience with the topic we're talking about today.
I even have some experience with this, which is unusual. We are going to give you our pieces of advice for
surgery.
Yeah. Surgeries. Yes.
Yeah.
It goes with the territory. not with all cancer treatment, but
a lot of it.
A lot of it.
Times.
Surgeries are a big part of it. And, sometimes they're, the most, drastic of things that are difficult. But
Yeah, I've had a lot of surgeries. Some of them have been directly related to the cancer. A lot of them have been related to side effects from things. But I feel like I'm a professional.
You ever counted them up?
No, but I should sometime.
Yeah, it's almost every part of your body, too. Like from head to toe. Yeah.
Well, foot for sure.
Nothing I get. Oh, head. Yeah.
Oh, yeah, head. All right.
Head.
I made...
Hand?
No, foot.
I thought you broke your hand.
I did, but that one healed on its own.
Okay.
One thing, but I'm missing a rib.
Okay.
Mm-hmm. Double mastectomy. Appendix, but that was beforehand.
Reconstruction.
Mouth surgeries.
Multiple ports.
Oh, multiple ports. Yeah, I had it.
Or foot.
Multiple times. Yeah.
Okay.
I got it. Yeah.
And that's not. We're forgetting 30 of them that
sure.
were minor, but still a surgery where they put you under.
One time, yeah.
For sure. All right, so we've kind of broken this down into leading up to the surgery, the day of surgery, and post-surgery advice.
Yep.
Okay.
So, when you know that a surgery is coming, if you have the ability, if it's not something that is like, we need to do this now, I would say, look at the timeline. Mm-hmm. Look at what makes the most sense for you. I've had a couple of surgeries kind of right before Thanksgiving because it allowed me to take just a day or two off, then get the rest of the week off, and then also knowing that it's kind of quiet, like in my job, in the weeks after that, so that I could kind of just slide right into then like a Christmas break or something like that.
Sure.
So, people, I think...
And everybody, if you're working, you have a busy time, a slow time.
Right. And I get it. Sometimes you don't want to take your slow time to,
Mm-hmm.
and that's fine too. But just think about what works good for you and if possible, make it happen that way. Right?
So many of your surgeries that you didn't have a say in.
Yeah.
Especially in the beginning, it was like, we're doing this and we got to do this and boom, and it was done. And there was none of that planning. But then many of them after, you did have somewhat of a say.
My last reconstruction that I did, we had it planned for months in advance. And partly that was both of our schedules, the surgeons and mine. So, plan. And then know what the procedure. So, you want to talk about this one?
Yeah. It's best to hear it from the horse's mouth. So, those questions that you have, literally anything about it. How long it takes for the surgery. What am I going to feel like right after? What am I going to feel like a couple days later? What can I do? What can't I do? All of these. Ideally, you'd like to hear that from the surgeon or the nurse practitioner, or PA, whoever is giving that. But so many times we don't even know what to ask. So I think it's a good idea to go in with questions prepared. Mm-hmm. And a lot of times you can just, and this is something that is okay to Google, you can Google the surgery. And they have a pretty good snapshot on pretty much every surgery of what to expect. Well, you might read something on there and go, wait, what? Or is that true? That's a great question to bring in there. They're going to cover the basics with you, but beyond that, I think be prepared for and have those questions ready.
Yeah. Along with that, when you're in there, they usually do print off something or they... Bless you.
Yeah.
They will put instructions in your portal of, things to do kind of to prepare and day of and things like that. read those. I mean, some of them are pretty, and it's not, I will say, I have waited too long on those sometimes where they'll be like, wash with antibacterial soap, and I'm like, oh crud, and I'm out running out to get that soap or whatever. So, when you just look over that kind of stuff so that you know how to prepare leading up to the surgery. I always think about what I'm going to wear.
Well, that stuff that's not in the brochure a lot of times is, what do you wear? Something like that isn't going to be covered in there.
Yep.
But think it through.
Yeah.
Like, what about what you wear?
Well, for me, I mean, comfort is key. Also, when you're sore, you don't want a lot of closures necessarily. But I will say that, like, I've had a lot of surgeries around my chest and things like that, and sometimes it's a lot easier to put something on that buttons up versus thinking about having to lift my arms through something. So
yeah, it's easy to take things off before the surgery.
Yes, it's harder to put them back on.
And this would apply if it's a knee or if it's an ankle. Just be smart about how you're getting it back on, and can you put that back on?
Yes, exactly.
What are you left with after the surgery, and casts and boots and splints and all of these things? Ask those questions about what specifically, because if you're in that office and they're right there, they'll give you great advice on that. They've done this so many times, but they're not gonna, honestly, they probably aren't gonna think to tell you to do that.
Right. So a lot of times what you're gonna wear, definitely showering. We were talking about food and nutrition. I mean, it's good to be eating as healthfully as possible leading up to it. Meds that you get and pain meds can really impact kind of your constipation, that kind of stuff. So, do yourself a favor and just be eating healthily before that. The other thing that I think is huge that people don't think about is hydration, because of course you're going to have to stop drinking, water or whatever the night before, but hydrate the days before that. Like, putting an IV in is so much easier when you're hydrated. So drink water coming up into that surgery.
Very important. Yeah.
It just really, I mean, a lot of times the worst part of the whole thing is the IV stick for people, when they're prepping. Yes, right? So you can help yourself out by being hydrated.
And so many times, whatever surgery it is going to, put us on the couch for a little while, or in bed for a little while, or for a long while.
Yeah.
Take advantage of not being there and get out and walk, or if you can run or ride a bike, or fitness. It's going to stop for a little bit. And that all of my surgeries were usually joints that I've mistreated. So I really, leading up to it, I wanted to go hard for me.
You always want to be as healthy as you can going into something. So from a work standpoint, just take care of the things you can take care of. Let people know that you're going to be off and that you really don't want to be bothered. I mean, which
goes back to good questions for them. Not only how long am I going to be on the couch, but how long should I be off work? And now, if you know that leading up to it, and you have a week or two before the surgery to plan that stuff, it can be a little better. I mean,
I agree. I think this is also a place where it's okay to have some boundaries and to be good to yourself and take the time to rest and recover, and without the draw of work, telling you whatever, asking you for things. The downside to this cycle of constant internet and phones is that everybody feels like they can always get a hold of somebody, and I think it's okay to observe those boundaries for yourself. Excuse me.
I do too. I think it depends on you. For me, I wanted to get back to work the next day. Like, I was good doing Zooms or doing, we didn't have Zooms all the time, but making phone calls and doing that, that gave me something to do. Versus just sitting on the couch. But everybody's different. I get it.
I agree. And also, you, excuse me, being on your phone the next day was...
We'll cover that later.
So get things that you can taken care of, get them taken care of, right? Mm-hmm. Clear the time off, all that kind of things. Here's another thing. Have the things you need for coming home. Things like, we always have Advil and Tylenol. Like, we will buy that stuff ahead of time. We, think about food that might be easy to grab or,
Easy on the stomach.
Easy on the stomach, exactly.
Not a lot of prep to it. Maybe pre-prep some foods that
Yes. Some,
Most of the time when we've had surgery, we'll talk about post-surgery later, but, you're usually alone. A lot of people are because everybody else is at work.
Right.
So think about those. What can you make it easier for you there?
Yeah, so that's the next thing that we said too was have a plan for the days following surgery. Like, who do you need? Like, can you be home alone all day, and is that not a problem? We have 2 big dogs. Like, there's been times that I couldn't even get up to let them out necessarily. So,
Sure.
like, somebody need to let the dogs out, or can somebody come and make lunch, or whatever that looks like? Or maybe,
can you get out of bed or off the couch to go to the bathroom?
Right.
What's the plan if you can't?
Yes.
Just all of that, if it's planned, it usually goes pretty well for most people.
Yeah.
Instead of the emergency, oh shit, what am I going to do?
Yeah, exactly. Or ending up trying to do things that then, put you in a precarious situation. So the other thing I said was a lazy boy. I feel like the lazy boy.
It's adjustable.
Oh my gosh, it's gotten me through so many. Yeah, it's just, and some people I know hate them or whatever.
Well, we're being so vague in what the surgery is. It really does matter. What are you having surgery on, and what is going to be the side effect of that, depending on that kind of stuff. Have something to do.
Yeah.
At least, do you have? Is there going to be a TV? Can you watch that TV? Is there enough on there? Do you like reading books? Get a stack of them.
Do you want to?
Do you want to just listen to music? Do you have a way to do that?
Yeah.
Have your chargers by you. All of that stuff. If you can plan it, man, you're just going to come home and that is your spot. And we usually do that with the lazy boy. It's just like that becomes your spot. And,
Good. All right. So day of.
Game day.
Oh, Lord. We cannot not do football.
Yeah.
So think about what you're wearing. And not just for what is comfortable, but also for what you can put back on.
If you're wearing a t-shirt, it doesn't matter if you're having knee surgery. If you're wearing a t-shirt, make it a big one.
Yeah.
Don't make it tight. It's just easier to get on and off. Stuff like that.
Yeah. If you are an anxious person or your caregiver is an anxious person,
we're going to be early.
Be early.
Yeah. Early is on time. On time is late.
It does. And think about that in terms of.
But that's harder for a lot of surgeries because they're like, you got to be there at 5 a.m. and it's hard to be early when that happens.
Yeah, well, I would say, but it's almost like, I was going to say consider traffic and things like that, because actually getting to Ann Arbor at 5 a.m. is a lot easier than getting there at 8 a.m. because of traffic.
In some places like Mayo, the surgeries at Mayo and stuff, it's great. We just hop in the town car and they take us right there, and it's the best place ever to do surgery, by the way. Mayo Clinic, well done.
Well done. And also, I'll give them a shout out for day of caffeine pills.
Yes.
So great for coffee drinkers, people who are used to caffeine. They give you the pill, and
so you don't wake up with a headache from
a caffeine
that.
Headache.
Yeah.
Yes. Yes, that's where U of M, you can get on board with that anytime. We'd love it. All right.
Next one. This is big for everybody involved.
Know that you will likely be waiting for hours.
You might get bumped 3 times because they have more important surgeries.
Yeah.
They're more important. That's got to be okay, right? And that's happened to us a lot.
Even just the process of they want you there so that they can take their time getting things, each kind of part of it. Getting you registered, getting you back, getting somebody to put the IV in, getting the anesthesia, there, everybody, all of it. It takes time. Just know you might be waiting for a long time.
Well, when we wait in a restaurant, we're like, what the heck is going on back there? What are they? Are they taking a break or what? Our brain goes, that's not happening in a surgery room.
Right.
That surgery room is booked all day long, especially at the bigger hospitals. It is nonstop booked. If you get bumped, you got bumped for a reason.
Yeah.
That means it was a life or death situation that wasn't important as yours. Hopefully yours wasn't a life or death. I felt bad about saying that now that I said it out loud. But you do have to remember that, even though it is frustrating. And you know why it's frustrating? Because you were scheduled for your 10 o'clock surgery. You haven't eaten for 24 hours, and now you have your surgery at 3. That is really hard, and you are going to be hangry.
Yeah. I will say, kind of, maybe this is jumping back to, if you have any say, I would always opt for a morning surgery. Like, I always,
Absolutely.
if you have any say,
You
be
don't.
the first surgery.
You don't.
So, another thing, though, the day of, that your person that's with you can do is pick up your meds, like your pain meds, at the hospital pharmacy. That saves... It's so
you
much
don't have to
nicer.
stop on the way home, or they don't have to go back out.
Yes.
They don't, do they have your insurance? I don't know if they're family or not. All of that.
Yeah, that's
Salt.
been great. And again, that's something that is easier to do at the bigger hospitals. But it's so much easier. It just runs a lot better. And then think about the drive. If you're not staying overnight, it's not as likely that you're going to be staying overnight anymore.
Especially if it's not a 15-minute drive for you.
Right.
If it's longer.
Right. Think about the drive home. What do you need that will make things...
Crackers.
Something like that.
Barf bag.
Yeah, I've thrown up many times on the way
You can
home.
leave the hospital feeling really good, actually, and then just the motion of the car and everything can get to you. A bottle of water, some crackers, a barf bag can go a long way to getting you home. Because we don't also want to stop at a rest stop and throw up. No. It's better just to get it out. It's anesthesia, puking anyway. You got a little bit of crackers that they made you eat at the hospital, and that's all that's coming up.
Yeah. Yeah.
Okay.
Lovely.
Yeah, all these, they're real, and they help. And if you have that barf bag, you are going to thank us.
Yes.
You're going to be like, what a great idea. It didn't go on the floorboard. Yes.
Right. I feel like that's a bit of a... Are you... The last time I puked at puking on, I did throw up on the floorboard. Sorry.
It was her car, though.
It was my car. It's recovered. It's
okay.
It's okay.
Okay, so you made it through game day. You get back home. You've made all of these preparations. You got your chair, your couch. It's all set. And you got stuff ready to go. Okay, what do you got for them now?
Well, especially if you are Larry Jose, you then have somebody take your phone away so that they cannot be on social media commenting on everything under the sun.
Oh man, those drugs are good. And they just make you feel good. I'm happy. And oh God.
So just know that
it's hilarious what I do. Like, I look back at all of my surgeries and social media, the equivalent of that, you get those reminders. Oh my Lord. I'm sorry, people.
Yeah.
Somebody should take my phone.
Yeah. Immediately when we get home, we make a schedule for pain meds. And I cannot tell you enough, as a therapist, but also as a professional patient, stay up on your pain meds. And that can be Advil and Tylenol. That I'm not pushing the bigger drugs. I'm just saying stay on them.
Even if you feel good, she's saying.
Even if you feel good.
Yep.
And make a schedule. So we've done it multiple ways. Whatever works for you, you can set alarms on your phone. And I don't know if you know this, but you can literally label what that alarm is for. So it could say Advil and then Tylenol.
Mm-hmm. But I like we usually do a checklist.
We do a checklist.
With dates and times. Yeah,
because again, it's when all you're doing is sleeping and you kind of go, did I take that? I don't know if I took that.
I don't even know if it's 8 a.m. or p.m.
Right, exactly.
Yeah, you can be in a stupor.
Just a piece of paper and a checklist works really well. But
and that's even for if it's not you responsible for that as a patient, somebody else doing it for you. Your life gets crazy too. Did I or not?
Yeah, did we? Yeah. And it's helpful for everybody. It's helpful for when people do, like if I'm home alone recovering, but then somebody comes over or you come home from work, then it's just easy to check that off and know,
Maybe they've asked you to track other things like temperature, blood pressure, something specific about that surgery, that can go on that list too, based on the time and the meds and what you took. And boy, that would be really helpful if something goes wrong, that the doctors have that information.
Yeah, and if something does go wrong, it is really nice to be able to say, "Oh, I took this at 2:00, and I took that at yeah, right." So, I think it cycles a little bit. So a lot of times people get home and feel great, and then they start to hurt a little bit.
For sure.
So just understand that. One, the pain meds will help, but I mean, you're still coming off of like really good meds from surgery, so it's likely that it's going to get more painful, coming off of it. So
that's why you stay up on your meds.
Yes.
On eating the Tylenol and Motrin. Yep.
Yeah. And then don't push it, but move if you can. The more you move, the better your body works, the better you're going to feel. Just again, we talked a little bit about like constipation. Pain meds can make you very constipated. The more you're walking,
again, hydrating.
Hydrating, fluids are definitely your friend for that.
In the beginning, if you are going to go for a walk or something, do it with somebody. I mean, in the beginning there. And this all depends on what type of surgery. We have to be vague on this, but yeah.
Well, and again, I mean, I also have many times like people, like not gone outside or just I walk in place. I literally just walk in place, like just moving my feet, So there is ways to kind of just get some movement in without doing anything really crazy. So I think those are big.
Those are big. This will make your experience with surgery better. Doesn't make it good. You're still going under the knife. But you do a lot of these things here, and it's going to feel like it's fairly organized and that you have things thought of ahead of time, which is just going to make the days post-surgery much better.
Yeah.
Yep.
Well,
hopefully it helps.
Yeah, I hope it helps too. Now I think I need to count up all the surgeries. And
I think you should too.
Come back with a number.
No chance you can remember all of them.
It's so funny when you get the paperwork and they're like list prior surgeries. I'm like, no way. No, not doing it. Anyway. All right. Well, we hope that was helpful.
Yep.
And we will talk to you soon.
We'll see you.